So yeah, I'm just here to tell you a little bit more about how to actually get involved. As Tamara said, it is through what we call a tender, and it's basically an application form, just so we can really check that you've got the capacity and that you're suitable for the programme, and that you're going to fit well with the school that you've applied for as well, because it's important that you're a good fit for each other. So firstly, I will just talk about how to register on Tenderlink. So as Tamara mentioned, you can get to it through our website, and that will take you straight to the Tenderlink page, which will essentially look like this. And you just need to press on the registration button on the dashboard, and it's really simple. It takes 2 minutes, and it's obviously free of charge to register as well. So you just need to fill in the details on that field there. And then after that, you'll be asked to accept some terms and conditions, nothing untoward, and then your registration is complete. So applying for the programme is a good way for your practice to think about how it will run in practice, so how your clinic will run the scheme in practice. So it might sound great, but actually you need to think about how it's going to work day to day. So some tips for writing your tender. It's really important that you leave enough time to plan effectively. So the tender is open for 4 weeks, so it closes on the 10th of the 10th. So don't leave it all till the last minute, because A, you never know if there's going to be any technical issues when you're trying to upload your answers, and B, a rushed answer probably isn't going to be the greatest that you've ever put out. We'd also ask you to consider how the programme requirements incorporate into your business as usual practices, and I'll talk a little bit about that later, how that might work for doctors in schools. And utilise the information on the North West Melbourne website. There's a lot of extra information about there for priority health and populations and things like that, how you can make sure that you're addressing those when you're addressing the programme. And also consider our quadruple aim model, which is to improve patient experience, improve provider experience, improve population health, and be sustainable. So how's your approach to the Doctors in Schools programme going to address that model? And also think about who in your organisation is best suited to write a response to the individual tender questions. So it might not always be administration that's best suited to write that. Just some more practical tips for when you're filling out your tender application. Pay close attention to the weightings attributed to each question. So there's a set of 5 overarching questions, and each of those are given a weighting out of 100, and those weightings show how important we feel that question is. So if one is weighted 10% and one is weighted 30%, say, you know that one that's weighted 30% is going to be slightly more important to us, and that's a good one to really focus and write a little bit more about. Read through all the documents that are highlighted and that are attached to the request for tender on the website. They'll give you lots of extra information that you can think about and try to include when you're writing your answer. When you've read through all the documents, if there's any clarification that you need, you can ask questions through the Tenderlink portal, so you can see when you get onto the page, there's a link to ask any questions that you need clarification for. And remember to get those questions in sort of early enough that we've got time to answer them. It's good practice to maybe physically check off the criteria that we've set out when you're writing your answers, and that way you know you've covered everything. And also we provide what we call an evaluation rubric, which is essentially how we ourselves evaluate the answers. So you could maybe even do a test evaluation on your own answer, just something to really help make sure that you're going to get the best out of this. And some more practical tips: obviously read the questions thoroughly, and try to really use positive language, like effectively, demonstrated, etc. Try not to use like woolly language like if, I maybe could do this, as it doesn't it doesn't read well, essentially. Be clear and concise, and you don't have to do it as a big long essay style answer. You can use bullet points, subheadings, numbers to separate out your points. Also, on note of being clear and concise, remember my teachers in schools always used to give an example that you have to pee all over your work. So point, evidence, explain. So make your point, give your evidence, and explain why that links to the question. Keep in mind that the evaluation panel may not always be made up of people that are really have in-depth knowledge of clinical terms. So try and avoid using medical jargon, essentially. Obviously, there are some terms that you can't get away from using, but just try to keep in mind that some people might not understand that. And always use examples and case studies to back up your responses, so you can attach extra evidence, certificates and things like that if needed also. So specifically for your Doctors in Secondary Schools tender response, we do have Doctors in Secondary Schools operational guidelines that will be attached to the request for tender. So they're really good to read through, and really important you read through those before constructing your answer, as that will essentially mean you're meeting the correct criteria. When thinking about who's best suited to construct your answer, think about getting input from your GP and your practice nurse who you think may be involved, as it's good to get their insight. And if you're applying for more than one school, as you'll see online, there's a separate application form for each school. That's just so we can make it fair and equitable to each school. As I say, you can apply for more than one, and you can duplicate your answers as they're all exactly the same, except they're just for a different school.